Hey guys, Ileana here. Today is December 17th that I am recording this, and of course it's just going to be day-to-day update on how I'm feeling with the coronavirus, COVID-19. I'm doing alright. That's really all I can say. I'm sick, I feel sick. Well, I don't know anyone who likes to be sick, but yeah, I'm feeling tired. It's all in my head. It's like I'm feeling tired, but I can't sleep. And it really sucks because I'm at the, I can't sleep and I'll stay awake until I'm really tired. So, I don't know, that's not really the best way to get rest. But I'm just really uncomfortable. I just feel really uncomfortable. My temperature is fine. Last I took my temperature, it was like 97 or something like that. So it goes between 97 and 98. But I just feel hot and sticky. Last night, of course, I took a shower and I washed the sheets, so that helped a little bit, but again, I'm just back to feeling sticky. Not that I really care about those, the least of my problems, but I am getting acne. I just do that when I get sick too. Of course, my brain is just running slow. I just feel like it's running slow. Everything is literally in my head. My headaches keep coming and going, which is really annoying. I haven't taken a medicine for it in the last couple of days. The first time I took medicine for it is because I did have that pain in my head. And it was after I had worked and I felt like I had pushed myself through work. And I think that's what really pushed me to be nauseous and have that splitting headache. So I'd taken migraine medicine and my headache hasn't been as bad as it was that day. But it comes and goes, and it's really annoying because it's just that sharp pain and it's just moving all like this, and it comes and goes. It doesn't stay, but it's a sharp pain. It's not even like a numbingness, like it's like I have an actual headache. I don't know. I'm mucusy. Originally I was really dried out in my nose, and then I would have a lot of mucus coming out. Now, like, I have all the mucus in my nose, and the mucus is like super dry and just stuck in there and stabby, and like I clean my nose out. I can't even blow it out because it's dried and gross. I clean it out of my nose. I don't know if that has anything to do with COVID, but right now, what time is it? It is 10:22 a.m. and I have been awake since probably like 2 a.m. I think that's what I remember. I had fallen asleep. Yeah, I went to sleep probably sometime after this yesterday, sometime after 10 a.m. yesterday. I woke up for my doctor's appointment at 4 p.m. I had my video webcam doctor's appointment, and I got all of my medicine ordered, and what else? I'm trying to remember. I got all my medicine ordered, and I probably fell back to sleep around 9 p.m. So I maybe got 5 hours of sleep. I was maybe up for 5 more hours, and then I went to sleep, woke back up around 2 a.m. from what I can remember. Yeah, I took a shower, did laundry during that time, and now I'm still up here. It's sometime after 10 a.m. Yeah, it's just, I feel uncomfortable and gross, and it's just all up here. And I'm still having that butt problem I mentioned in the first video, so CVS is going to deliver my medications, and I got a pulse oximeter. Whenever you go into your doctor's office, whenever you go into the hospital, they check your vitals and they put that thing on your finger. It clamps onto your finger and it gets your pulse and it gets your oxygen. That's what it is. It's a little mini one. They sell them at CVS for $50, and I've seen them for less at other places, but I need something now and I can't really go out and find something cheaper. So I did spend already $100. That was the most expensive thing, really. Again, I have insurance. I work at the hospital. Yay me. Oh my gosh. That was the most expensive thing. It was $49.99. So we are going to see where I'm at. Last I checked, I was at 98% with my oxygen, which that's definitely not bad, but what's the reason for me not being at 100%? COVID. So yeah, I have asthma. That is one of our big concerns, is me being able to breathe. I mean, that's the concern for everybody. That's the problem with COVID. Your oxygen starts going down. But I have a slightly higher chance of it causing me problems. Fortunately, again, a more positive thing is that I am 26. I am a young person. Young people do tend to get through it better. But I have health problems that give me reason to be more concerned over different areas of whatever symptoms I'm showing, right? I have, just in case, because I know the reality of what happens to some people, just in case, I have my emergency grab bag to go to the hospital with, and some of the things that I'm including on there, which I don't have everything thrown in there. Like, I would have to grab my chargers and my phone to throw into the bag if I'm having to go to the hospital, but it is just like a gym bag. I have some extra undies in there just so that, like, the other people don't have to worry about getting that for me. I know the hospital runs out of stuff, so, sometimes they wind up having to give patients, the briefs, the pull-up briefs, but, if I bring my own stuff I'm more comfortable being in anyways, they can provide that to other people, people who are incontinent, yeah, so, I mean, I just know, working in the hospital, I just know everything that they're having to go through right now and how things are limited, so I have some undies in there. I also packed a bunch of, like, leggings, like these types of leggings, just so that I don't have any shorts. I don't recommend packing like a whole wardrobe. Just wear the gown. It's easier on them because they have a bunch of things they have to plug into you and all this and all that, and oh my god. But obviously I would be in the clothes that I'm going in, but I just brought some, like, the little leggings so I can wear underneath the gown so my booty ain't hanging out. And I brought some undies just in case, because you gotta try and be taking a shower. A lot of people don't take showers because they're really tired, and other people don't need to be taking showers because they can't get out of the bed. That's a different story. But trying to get up, trying to move around. What else? So I would have my chargers in there. I would have I want to bring an extension cord because honestly, like on my floor especially, our plugs are like all over the place and they're not convenient for the patient to put their phone plug in the wall unless you have like one of those 10-foot chargers. It's crazy. But an extension cord to plug your phone into, and some lotion, and what else did I put in there? I think I'm gonna include like just like little sanitary stuff, like my own face wash and shampoo and things like that. That's what I want to do. I might throw a toothbrush in there, have my own toothbrush, just cause my parents got me like a ton of toothbrushes that I could brush my teeth and throw them away here, so I'd probably bring a toothbrush with me. And I don't know, maybe I should bring like a book or something. Maybe not. I'd probably want to throw that book away afterward. I don't know. The bag is just in case. But, what else? I just know that already with me getting up and moving around, I already know that, like, I'm kind of dizzy. It kind of feels like I'm kind of, like, not aware of my space. I definitely keep, like, running into the door. So yeah, I have to be careful with that. That's like one of the things where people don't realize that they're gonna fall. Fall risk. So I'm steady on my feet, but I can tell that I'm just not aware of my space around me. So that's another thing that's affecting me. And again, I'm like in bed and I'm in the room and I get up to go to the bathroom, and like I said, we watched the sheets. That's how I stayed active, and I put the sheets back on the bed, and that was pretty exhausting, honestly. And I flipped the mattress like to, you're supposed to, when you clean your mattress, you should like flip your mattress from like the end that you've been sleeping on for a long time to flip it over to the other end, so that like you can stop putting your stinky head on the same spot or something. I don't know. I'm tired, guys. I'm tired. I might record a little bit more because I know the CVS delivery. Yeah. Yeah. I'm tired right now, but I'll talk to you guys in a bit. Hey guys, I'm back. It is after 12 p.m. I still haven't slept. I can't sleep. My medications came in. Fun. CVS, they have been delivering medications, and I just never used it because, annoyingly enough, right now, the CVS is literally right next to me, so like we would just go pick up my medications in the drive-thru. Now that I have COVID, I can't go anywhere, and we're just treating my husband as if he is positive. His test hasn't come back positive. He's just waiting on his results to come back. But yeah, so we went ahead and used the CVS delivery, and it was really quick because they're right next door to us. So really nice. And they even sent us a picture. They texted me and they're just like, is it okay if we can leave it on the door? And I said yes. And then they sent a picture that they left it on the door, and it was like super easy. So anyways, here's my nice CVS bag. Wow, let's do a haul. Let's do a haul. What did I get? What did I get, guys? Okay, let's do the fun thing. Let's do the fun thing. I already opened it. I threw everything out. I got my pulse oximeter. It works. I already tried it out. Make sure it's working. It totally is. My oxygen's still at 98%. So that's good. And it comes with instructions, and it comes with a cute little lanyard so I can wear it on my wrist or wear it around my neck, maybe if it fits over my head, I don't know. And some styrofoam, and it's right here, and it's just a little thing. It was $49.99, and you just put it, hold on, sorry, look. You just do this. You just put it on your finger. Super easy. It's lightweight. And then you push this button. It has 2 AAA batteries. Is it gonna read? What does that say? It needs to read my oxygen better because I hope I'm not at 96%. That's not good. Okay, I put it back on my ooh, 99. There we go. I like that a lot better. 99%. That's where I'm supposed to be at, guys. Okay, for some reason it doesn't want to read my right hand. I was at 96% on my right hand, so, but on my left hand, 99.98. So, yay. Let me see. Hold on. There you go. It's upside down. That's upside down. It's not a 66. It's facing away from me. Somebody in the reviews was like super mad over that. I'm like, I'm good. I can read it, guys. Someone in the reviews gave it like a 1-star review because they're just like, this reads upside down. I'm just like, but does it work? It works good. So that's good, guys. Okay, so let's get into the haul, the drug haul. Oh my god. Okay, so I am taking Excedrin for my headaches. I am taking vitamin C, zinc, B12 for my vitamins. I'm also taking vitamin D. That is my everyday medicine that I have been taking for years. I take vitamin D, so I want to make sure and keep doing that. I take Symbicort, which is an everyday inhaler for my asthma. I also have my rescue inhaler. I also take Montelukast, which is another like kind of allergy medication for asthma, and I take escitalopram, which is my my anxiety medication. So those are my asthma medications, and that those are my medications that I take every day. And then I'm taking the zinc, the vitamin C, and the B12. Everybody who is diagnosed with COVID, those are the vitamins that they really pump into you. So let's see what's going on. My prescription. Let's see. I have to remember what everything is. So I'm gonna may cause drowsiness. Is this my Guys, I don't even remember. Oh I can't even do a haul because I have 4 other medicines here that are added on. One of them, oh my gosh, my albuterol is like a lower price. This is my rescue inhaler. My albuterol is my rescue inhaler, so I needed that because the expiration date was actually going up sometime next year, probably like January or something like that. So I was just like, yes, I'll go ahead and get my thing because my doctor said if I am feeling, if I'm having a hard time breathing, then I can definitely take my rescue inhaler. It's there to help me, but of course, if that's why I'm monitoring my oxygen, because then going to the hospital, yeah. So I'm trying to remember. Okay guys, so I figured out what everything was. I had to like focus on what was all my medicines. I have a lot of medicines. Okay, so I already knew what, see, if I take everything for years every day, I know what they are. So my albuterol, I already knew that was my rescue inhaler. That was my new one that came in. And then some of these just have names I can't even see. Azithromycin. That is like the infection medication that I'm going to be taking. So I need to take one today. Well, not take one. It says 2 tablets on your first day, then 1 tablet for the other 4 days. So hopefully that kind of helps boost me. So basically, you know, again, like everything that's been happening with me, I haven't had medications that are directly attacking me being sick, you know. So everyone is hoping that if I take these starter beginning medications, that this will help me bounce back, and hopefully I'm fine. People who are on the lower end of symptoms, I guess you could say, they can usually bounce back after the earliest a week. So that is what everyone is hoping for me, because COVID is not good. We don't want it to last longer, although it is common that a lot of people can be out 1 to 2 months sick, and then things start getting bad when you have to stay in the hospital, that sort of thing. Okay, so yes, this is the one that I have to take every day. Not every day, but just until it's finished. It's just, what, 5 days? 5 days. It's 5 days. I need to take it today and then 4 more days. This is benzonatate. Is for cough. I have an occasional cough. And then this is my new nausea medication, which I think is Zofran. Ondansetron. I think is Zofran. That's my nausea medication because, again, like, that's what really gets people. So my nausea kicks in when I am moving more often. So I need to keep moving. And I need to not be nauseous. So when I start getting nauseous, now I have that, and it'll help me. So I'm really glad for that because, yeah, it's not good to be not being able to take things in. So far, I have been able to keep everything down. It was just one day where, again, it was after I had gone to work, where obviously I had pushed myself way too much, and I couldn't keep things down after that. So, that's good, but I have been nauseous, and, it is to the point, like, when I get nauseous, it is to the point where, like, I'm nearly there, like, I'm really holding it in, so, But that was a fun little haul, guys. We'll see how it's going. Like I said, my symptoms for the last couple days now is just everything up here, just back and forth. Like, all of a sudden I'll feel fine, and then all of a sudden I'll be fine, and then all of a sudden it just like hits me again, and it's all up here, and I just feel like uncomfortable. I can't think. I'm just like looking at myself, like, see if I'm like this. My color's a little gone, but if I'm like this, I don't look so tired. Don't look so tired. But if I'm like this, you can like see how tired I am. Just, I gotta stay like this. And you can't tell. Okay, guys. Yeah, just going to update again.